Assalamu alaikum my dear students. Today I will be demonstrating you about the atelectasis and giving you the short review about this disease. So in this disease what happens that collapse of alveoli occurs. Alveoli gets collapsed. Alveoli gets collapsed. Or you can say that patency of alveoli is lost. Patency is lost. So there are two reasons for this. The first reason is the obstruction of the airway, like bronchi. So for example, explaining you about this obstruction factor. So for example, you can say that if there is the mucus plaque which is accumulated in the bronchi, so what happens that mucus plaque would be accumulated in the bronchi. So what happens that in the alveoli there would be air present. So what happens that there will be perfusion, blood capillaries attached with the alveoli, so blood would easily get that air which is available in the alveoli. So alveoli would be empty because there is the mucus plaque that has been stuck into the bronchi. So what will happen that alveoli becomes collapsed. Now how? For example, this is the alveoli and here the mucus plaque has been accumulated, or you can say has been stuck here. So what would happen that these are the blood capillaries. So the air which is present here would be utilized by this blood. The oxygen would be delivered to this blood and this would remain, and then this alveoli would become empty. So due to this emptiness, vacuum would be created and the alveoli would become collapse. So this is the cause, first cause of the that's why obstruction is the primary cause of this atelectasis, which is the collapsing of the alveoli. In the second condition, what would happen that whenever there is a vacuum creation in any, you can say, in any region, so that vacuum actually tries to, you can say, pull that air. So it would try to pull that air that is present above this area. So what would happen that this mucus plaque would get stuck in this alveoli. So again, in both the conditions, the surface area would be reducing and the normal ventilation perfusion would not be occurring. So this is the first cause of atelectasis. Now the second cause of atelectasis is the lack of surfactant. We know that surfactant keeps the alveoli patent. So if there is a lack of surfactant, that alveoli would become collapse. So actually surfactant decreases the surface tension. So if there is a lack of surfactant, the surface tension would be increasing. The surface tension would increase in the absence of surfactant. So this would cause the atelectasis. So number one cause of the atelectasis is the obstruction. It is, what does it cause? Obstruction actually obstruction occurs due to the accumulation of you can say mucus plaque, and that air is delivered to the blood. Vacuum is created inside the alveoli becomes collapsed. In the second condition, vacuum tries to pull that air above the mucus plaque, and again that mucus plaque will be squeezed into this space, and again this alveoli becomes filled with the mucus plaque, and there would be the decreasing the result would be the decreased surface area. Okay, this is the obstruction. In the lack of surfactant, what happened? The surfactant actually decreases the surface tension and keeps the alveoli patent. So if there is the lack of surfactant, so the surface tension would increase and it would cause the atelectasis. So in this video I have explained you about the two causes of the atelectasis and hope you have understood it well. Last but not the least, don't forget subscribing MS Lectures. Thank you.